Good morning, everyone, and wow, what an honor it is for me to be here with all of you at this moment in time where we collectively, as health information professionals, have such a great opportunity to make a huge positive impact on healthcare. Catherine Lusk inspired us with her opening remarks about courageous leadership and common threads that bind us all together within this profession, our just causes, that embody our mission and our vision to empower people to impact health and a world where trusted information transforms health and healthcare by connecting people, systems, and ideas. Our CEO, Dr. Harris, shared with us that we have an opportunity to reimagine healthcare and be a part of a movement for change, and how we can work together to advance healthcare, the profession, and our own individual work. This past year has been difficult for us in so many ways. This COVID pandemic has challenged us to be resilient, creative in problem solving, and hopeful that we will soon return to some degree of normalcy. However, normalcy cannot be a return to the way things have always been done, because that simply is not good enough. Rather, we must be bold to reimagine our future by leveraging our health information knowledge, skills, and influence to drive improved outcomes. As I think about our profession and association, this quote from Vince Lombardi comes to mind. The man at the top of the mountain didn't fall there. To get to the top of that mountain safely, that individual had to have an extensive plan. They had to research information carefully. They had to consider alternate routes, gather supplies, consider weather conditions. That climber might have needed to organize a team of skilled climbers to make that journey a success. Like the mountain climber who makes it to the peak, AHIMA and our members, working together, have established ourselves as industry leaders, bringing together a unique set of skills across the healthcare, business, and technology fronts. We've come a long way since our founding, since 1928, and as an association of record librarians to present day, where we are an association of more than 100,000 professionals steeped in healthcare policy, data analytics, and technology. However, as complex as our tools of the profession may be, it really does come down to the following. Yes, health information is human information. To the IT professional, health information might be the electronic health record, and to the physician or the nurse, it might be a specific document, the H&P or the nursing assessment that they might be thinking about. To the coder or biller, it might be the record that's needed to code the record accurately or to create a clean claim. But of course, health information is all of that and so much more. To the patient or the patient's caregiver, health information is that critical story that captures a person's health history and status. The health story should be easily accessible, easily shared with other members of the healthcare team, and it should be effective and secure interoperability. Ultimately, the goal is to leverage trusted health information to drive better outcomes. Health information professionals are advocates for human information every step of the way. We make sure that documentation meets standards. We build and create systems where information can be both shared and protected. We gather and analyze data to turn it into information to identify best practices and improve outcomes. And we use our voice to amplify public health initiatives such as health equity, data integrity, and accurate patient identification. So, health information includes the convergence of technology, of people, of data and information, payment policies, and the list goes on and on. And at the center of it all is the health information professional. We're all familiar with the AHIMA mission and vision: empower people to impact health, and a world where trusted information transforms health and healthcare by connecting people, systems, and ideas. These are all such important concepts which the pandemic has really made all the more important and has placed the health information professional center stage. Think about what health information and our profession brings to the table: a sound understanding of disease processes and healthcare delivery systems, in-depth knowledge of classification systems and how that data can be used to generate actionable information, and how data and information in a readily accessible yet secure platform can help patients become engaged in their own healthcare and allow clinicians to provide a safe and effective care. We absolutely make a positive impact on health and are poised to grow that influence within healthcare and within the industry. And through our collective advocacy and public policy statements, AHIMA and its members are recognized as thought leaders when it comes to empowering people and creating standards and practices to promote trusted information. Examples of those can be seen on this slide, and I'll go through a few of them now. First, the naming pledge and patient identification. We understand the impact that patient misidentification can have on patient safety and that it creates barriers to interoperability. Last year, over 1,400 members took a pledge to adopt best practices in naming policies to eliminate patient misidentification. We also asked people to share how they are living the pledge, and those best submissions for that effort will be recognized at this year's House of Delegates meeting. Let me encourage each and every one of you to continue advocating and educating on standardized naming policies for data collection in the Master Patient Index, and please continue to tell stories how we as health information professionals are living that pledge and making a difference in accurate patient identification and matching. Next, championing social determinants of health initiatives in public policy and organizational practices. We understand that traditional healthcare only addresses a small component in an individual's overall health, and that factors including housing, employment status, availability of proper nutrition, and access to healthcare are all so important to promote individual and public health. Health information professionals understand how these Z codes and their expansion of their collection, data analytics, and advocacy efforts can improve health outcomes and reduce health inequities. Next, we understand and support continued use of telehealth services that are not limited by geography or the type of service. And of course, we are present to make sure that those services are documented appropriately and that they comply with standards for data collection. And also, the pandemic has brought to light the problems with our current healthcare infrastructure as it relates to coordinating public health, including disease surveillance, assuring accurate and timely information or trusted information, and that we have adequate workforce and systems in place and at the ready to be proactive instead of reactive to save lives and improve health outcomes. During our AHIMA Leadership Virtual Conference this past July, the staff, the board, and CSA leaders focused on leadership resilience. Topics discussed included how to be agile and strategic, and the importance of monitoring the landscape to best position ourselves for success. In other words, status quo will not suffice. We must be open-minded to new opportunities and be willing to adapt and grow our skill sets to meet the needs of the healthcare community and to best serve patients. As health information professionals, we play such a vital role in the delivery of quality, accessible, and affordable healthcare. With healthcare evolving so rapidly in terms of delivery models, including precision medicine, payment models such as value-based care, and the focus on data analytics to understand and promote health equity and access, it only stands to reason that our profession and our skill sets must evolve along with those things so that we can continue to make that positive impact on healthcare delivery. Change is definitely inevitable. There's no stopping it. Like it or not, it's going to happen either to you or with you. We will be more successful individually and collectively as a profession if we embrace that change and become an essential part of it. We can do this by being strategic in our thinking, surveilling the industry and technology to be hyper-aware of our environment, adding to our skill sets in data analytics, population health, or value-based payment strategies as examples. To continue to impact health, we need to evolve our knowledge and skills, and of course, champion those abilities through our work, publications, and speaking engagements. As we continue to reimagine healthcare and to grow our influence as health information professionals, your participation in conferences such as AHIMA21 and through AHIMA and CSA workshops, education programs, puts you on the right track to assure that you have the skills to promote better healthcare for all. And in closing, I wish to ask the following from each of you. Continue to innovate and be creative in carrying out our advocacy agenda by moving it forward into your communities and into your workplace. Be open-minded to new opportunities to evolve and to develop new skill sets to improve healthcare outcomes. And continue to collaborate with one another and to do your best to keep health information human information through promoting access, health equity, and trusted information. I look forward to working with all of you during the coming year. Thank you very much.